This is Dr. Khushboo Dewani, a practicing psychiatrist in Bangalore. I'm interested in women mental health, geriatric mental health, and have been closely working with senior healthcare services to provide treatment as well as evaluation for dementia. Today, I'm going to talk about dementia, which is a brain condition that causes gradual decline in cognitive abilities like thinking, memory, and reasoning, which may interfere with daily life. We see dementia in and out, however, sometimes it becomes difficult for us to identify dementia. Certain common symptoms which may see in our near and dear ones, which will help us in identification, include difficulty in remembering names, difficulty in recognizing faces, getting lost in familiar places, having trouble communicating, difficulty in carrying out day to day activities, personal care activities, taking bath, eating. Sometimes there may be repetition which may cause irritation to the family members. There may be behavioral changes, which are called as neuropsychiatric manifestations of dementia. These behavioral changes may include wandering away. They may also present with delusions, hallucinations, abusive words being used at home, mild being a very early stage, at which it is difficult to recognize dementia, which we generally miss, which is called as a process of normal aging. However, if treated at the right time, recognized, and treatment started early, these changes can be halted or can be delayed. As a result, the manifestation of severe dementia can occur late. The mild to severe dementia depends upon the manifestations that are present in dementia. The mild being an early stage, as I said, and in severe phases, we have a person which requires complete assistance with day-to-day activities, toilet going, sleeping, eating. Sometimes they may also require diapers being put. Now, what are these different kind of dementias that we see? Because when we use the term dementia, we generally talk about Alzheimer's dementia. However, we see multiple different dementias in our practice. These dementias could include Alzheimer's, vascular dementia, which is seen post strokes. There could be Lewy body dementias, and it could be frontotemporal dementia. Now, for general population, we believe that dementia is only loss of memory. But as I said, that it is memory, thinking, and reasoning, and also the personality of an individual. So, in some cases, we may also see personality disintegration or symptoms of personality change happening very early. These cases are of frontotemporal dementia, and in these cases, because there is no memory impairment, they are generally brought with behavioral manifestations or behavioral disturbances. Very important to understand that it is not just memory impairment which would define dementia, but other symptoms like thinking impairment, reasoning impairment, behavioral issues, personality disintegration, which may also manifest as dementia. Once we know or we identify someone has dementia, what can we do? The first and foremost would be to take help from a professional. Because dementia, because people believe that it is normal process of aging, is often left untreated. And when untreated, it may progress to severity. And when becoming severe, it may result in behavioral and psychiatric manifestations, which then become difficult to manage at home. So once you identify dementia in your near to dear ones, you have to make sure that you seek help either from a neurologist, a psychiatrist, or a physician who would help you to identify the changes of dementia and quantify the severity of dementia. There are few things that can be done for identifying dementia. There are few tests that are available. We generally use MRI brain as a test to identify the structural changes that may be happening in dementia. So dementia, there occurs a structural loss of brain matter. As a result, an MRI will show a change in the structure of the brain or loss of the cerebral matter and is easily identified on MRI. However, certain dementias, which for example the frontotemporal dementia, may show a disproportionate change in the structure of the brain, that is the frontal area or the front area of the brain may be more lost compared to other areas of the brain. Besides the imaging, there are other tests that are available for dementia, other scales which a clinician can use for dementia. These scales help us in identifying the severity of dementia. One of the most common scale that is used is MMSE, that is Mini Mental Status Examination Scale, which helps in identifying the severity of dementia, whether the person has difficulty in remembering the name of the place, where he's from, where he stays, which place he currently is in, the day, time, sometimes the orientation of the place. Once the diagnosis is made, we have to understand that dementia is generally a progressive disease. Progression means we can halt or we can delay the progression. However, it is going to eventually lead in severe forms of dementia. It cannot be cured. It cannot be cured, and meaning that we cannot reverse the changes that are happened. So the drugs that we use are generally to delay the course of dementia or slow the progress of dementia. Besides pharmacological management, there are a lot of psychological management that can be done in dementia. A good family support is the first thing that we need to start with. Less changes in the environment have been shown to have a protective impact. So many times we see that individuals with older parents staying in a different city would want to shift the parents with them, which causes a lot of changes in their environment. They are moved from their known environment to an unknown environment, which worsens the dementia symptoms. So therefore, lack of any change in the environment or lot of changes that are happening around them is something which can help the patients of dementia to prevent the severity of dementia. So one, we will prevent them from having a lot of changes. Second, a good healthy conversations with family members, having interaction with family members, making sure that they are engaged in activities. As soon as we are diagnosed with some kind of illness or disease, we tend to rest. So dementia is an illness or a disease where they cannot rest. They have to give exercise to their brain specifically besides the physical activity, and these brain exercises could be memory improving exercises. Memory improving exercises like solving crossword puzzles, solving Sudoku, having to read a book in a day, probably reading newspaper in the morning and then remembering what was there in the newspaper in the evening. So these simple activities will help in improving the memory of these individuals. Dementia is a disease which not only affects the individual but also the family. Therefore, family counseling becomes very important in dementia. Family has to be told about how the disease will progress, whether the disease is currently in the mild, moderate, or a severe phase. If the severity is there, the symptoms like hallucinations, delusions, which are occurring because of the severe dementia, need to be managed or taken care of with the help of medication. Family has to understand that it is a progressive disease. The symptoms may worsen even if when the patient is on the medication, but it will definitely slow the pace of the disease progress. Getting information out for early recognition and management of dementia is equally important, because we have seen if the dementia is diagnosed in an early stage and we give some certain neuroprotective agents, we give them drugs which can delay the progress of dementia. We have seen the patients to live for almost 20 to 30 years post the diagnosis of dementia without major severe dementia being settled in. Therefore, early recognition is something which should be promoted at the clinician level for regular follow-ups. I think early dementia symptoms can be picked up by the physicians and can be treated. So I would like to conclude by saying that early recognition of dementia in our near and dear ones can definitely help in improving their life, improving the life that they are going to live after the diagnosis of dementia, and also improves the quality of life of the caregiver. Thank you.